Okay, Jamie, if you just want to take us through what particular problems Ian's legs pose.
No problem. Well, Ian suffered a very bad injury to his lower limb in September and had multiple fractures of his tibia and his fibula. In terms of the structures in Ian's lower limb, he's injured the vast majority of them. Muscles have been torn, arteries ripped, nerves ripped, what we call compound fracture to the bone, which means it's in pieces. And 20, 30 years ago, he probably would have lost his leg. You can see this external fixator on the leg, which essentially is making sure that the fracture sites heal. It's integral to the bony healing. So Ian's rehabilitation really is centred around working to repair those structures that have been damaged. He, without a doubt, demonstrates a kind of level of motivation that most people wouldn't demonstrate. Joe Blogg's public would not demonstrate. A lot of people need kind of motivating to exercise and to go through rehabilitation, which with this type of frame on is actually a very painful process to go through. But Ian's the other way, actually needs to kind of hold him back rather than motivate him. So in terms of Ian's rehabilitation, he's as far on as he can possibly be at this stage. He could not be he could not have optimised his rehabilitation any further, and it's made my life very, very easy in the sense that I'm telling Ian what he can't do as much as anything, and he is very, very forthright asking, can I push this a bit further? Can I do a little bit more in the gym? Which is, from a physiotherapist point of view, is exactly what you want to hear, because you're going to get a much, much better outcome. So when Ian first came in to see us, he was using elbow crutches, and he was just about at the stage of putting weight through the limb. He's now fully weight bearing without elbow crutches. He lost all of his muscle in his quadriceps, hamstrings, and gluteal areas. He's now in the process of developing that muscle back. He's walking much, much better as a result. The antibiotics that he's taking and the various kind of surgical interventions and skin grafts and other things that he's had, he's responded well to all of those. So basically the problems we now currently are treating or dealing with are the fracture site of the tibia that's still healing, and also the fact that he suffered a nerve injury to his common peroneal nerve, which means his ankle movement is affected. So at the moment what we're doing is getting movement, optimising movement in the ankle joint, developing the strength in the lower limb muscles, and as soon as that frame comes off, we'll be doing a little bit more work on the rest of the lower limb musculature to develop it. And then we'll then be working with specialists with a view to sorting out the problem that he has with his nerve conduction. In terms of a timescale as to when Ian will return back to racing, that is as soon as absolutely possible. As soon as he can get on a bike, he will be. And one of the first things he said to me when he came to see me is, I want to be on the bike in 6 weeks. Obviously, with this extent of these injuries, it was never going to happen really. But Ian if there's any way he could have got on it, he would have got on it, got on that bike.
And the long-term prognosis, will he be back to near normal if everything goes to plan?
From my point of view, the body is excellent at healing itself, with obviously the help of surgeons, specialists and physiotherapists. The biggest threat to someone not recovering from this is the person's psychological impact. And Ian's level of motivation and his positive psychology mean that he, from a mental point of view, is very likely to get back to his very best again. So it's really a case of the physical aspects of his injury need to catch up with his kind of willpower, really. The bone will heal and is healing. The soft tissues, muscles that have been injured will strengthen up and come back again. The main difficulty relates to the nerve conduction in the lower limb. But again, neurosurgeons, neurospecialists, experts in this particular field, and I see no reason with their input why Ian shouldn't get back to bike riding at the very, very top level, really. Yeah.